just so happened that I was in a car accident October 3rd of 2013, and I realized that there was a lot unknown in the field of medicine about concussion, and our perception of our abilities with treating concussion is kind of here in the world, and we're really kind of at the ground level, ground floor. As I was a patient, basically a professional patient for about a year, I realized that there were a lot of gaps, and I was actually quite an experience having that dichotomy of both doctor and patient. So I hope to bring those gaps together, and by sharing my story and my experience to educate the world, essentially by telling them my story. So there are a lot of stigmas with concussion and post-concussive syndrome, and unfortunately a lot of those are stemming from legal law literature, because they kind of have beat the medical literature to the punch here. I think when we don't really know what's happening with the patient, we tell them to rest, or we think it's psychiatric. And a lot of the symptoms and deficits, like vestibular issues, ocular issues, lead to anxiety and or depressive disorders, but it doesn't mean it's necessarily the root cause. You really do feel crazy when you're going through a lot of things, because again, mine was a car accident, very benign fender bender, and you really don't think that you can be so sick from something so benign. I'd like to bring some light to how to identify these deficits, how to treat the ones that you're able to treat in your scope of practice, and how to refer appropriately to the right professional.